I'm Barbara DePietro with the National Healthcare for the Homeless Council. We joined the work to advance the framework for an equitable COVID homelessness response because we were alarmed that the public health and economic crises resulting from the COVID-19 pandemic have had inequitable impacts and are worsening racial disparities across the country. Despite these challenges, though, I am so inspired by the results achieved by 3 communities in Atlanta, Chicago, and the state of Connecticut. They've met the health and housing needs of people who were enduring homelessness during this global pandemic. We captured these insights in a recent brief, Strengthening Partnerships for Better Health Outcomes During COVID-19. Today, I'm speaking with leaders from Chicago who led this work: Ed Stellan, Executive Director at Heartland Alliance Health, and Beth Horwitz, Vice President of Strategy and Innovation at All Chicago. Beth and Ed, could you introduce yourself and your organization and tell us why you partnered together? Beth, let's start with you.
I'm Beth Horwitz, Vice President of Strategy and Innovation at All Chicago. We're the lead agency for the Chicago Continuum of Care that includes over 100 organizations and individuals that are dedicated to addressing and ending homelessness in Chicago. At the start of the pandemic, everyone was scared about what COVID-19 meant for clients and shelters, and we quickly realized that we needed expertise on healthcare. Heartland Alliance Health stepped in to lend their expertise in areas of infectious disease and healthcare service delivery. Throughout this pandemic, there has not been a single need that they have not helped meet.
I'm Ed Stellan, Executive Director, Heartland Alliance Health, which is a federally qualified health center and a healthcare for the homeless provider in Chicago. We began by conducting Q&A sessions with shelter staff and review documents about how to set up safe workspaces in shelters. Quality of care throughout the shelter system was improved by developing standards of care, which outline how to provide primary care and behavioral health services in a shelter-based setting, as well as infection control and client engagement and outreach strategies. And we work to ensure every shelter has an FQHC partner who provides a consistent set of services.
Along with Heartland Alliance Health, we connected with area hospitals, social services, shelter providers, the Chicago Departments of Public Health and Family and Support Services, and other healthcare providers to build the group now known as the Chicago Homelessness and Health Response Group for Equity, or CHARGE. This coalition pulls together a wide range of stakeholders to respond to COVID-19 and create the catalyst for broader change in ending homelessness. The CHARGE Collaborative is centered on social determinants of health. Hence, one's measure of success is whether someone has gained permanent housing, which is not a traditional healthcare outcome measure. Second, better service delivery at unsheltered encampment sites, which have expanded due to shelter decompressing, with a goal that at least 10% of housing placements come directly from unsheltered locations.
We are very pleased with the progress we've made. A comprehensive isolation center for COVID-19 involved clients was established, and many service providers brought services into the space so that those recuperating from the illness could access a broad range of services. Rush University Medical Center manages the care at the facility, with HAH staff providing care coordination and medication-assisted treatment for people with opioid use disorders. A nurse practitioner from Heartland Alliance oversees the coordination of our shelter-based care, which has expanded dramatically as a result of the CHARGE Coalition.
Every shelter now has a healthcare partner. Through the efforts of the CHARGE Coalition, not only have greater partnerships been established to ensure higher quality shelter-based care, but the city also provided an additional $400,000 toward the supplies and physical barriers needed to ensure infection control in the shelters. This is one of the first city investments through the Department of Public Health that focuses on homeless services with the goal of not just addressing COVID-19, but also ensuring the success of long-term partnerships between shelters and healthcare partners. CARES Act funding also moved 170 people straight from shelter to permanent housing. The city allocated $35 million in ESG CV funds towards rental subsidies and services that will allow the COC to ultimately house an additional 2,500 households.
Your progress linking health and housing is really inspiring. What would you say are your 3 keys to success?
Broaden the understanding of healthcare. Before this partnership, shelter staff thought it was just a doctor going into a shelter. But as their view of healthcare expanded, more services and venues have opened, such as housing, medication-assisted treatment, crisis intervention, benefits enrollment, etc.
Rely on the expertise. Heartland Alliance brought expertise and ability to leverage national best practices in providing healthcare to people enduring homelessness. This foundation helped with engaging other medical providers and made the homeless provider network feel more comfortable with what was happening and what to expect next.
Create local standards of care. Working with the health department and other health providers, Heartland Alliance established standards for infection control within shelters and a consistent set of services to be provided by healthcare providers, like how to go into a shelter and provide care, engagement strategies for both staff and clients, outreach strategies, supplies needed, etc.
And then with that said, do you have any final advice for others who are looking to create similar partnerships that you have?
Come to partnerships with an attitude of learning first and listening to others, understanding that you only know a little bit and other people know their little bit. Move at the speed of trust. Urgency is needed, but the goal is also to build enduring relationships and to strengthen your collaborative muscles. Learn from others and adopt what works well. Build on what others have done before you. Don't be afraid to reach out from other communities to ask questions and learn from each other. And ensure people with lived expertise are helping to shape the partnership. Their investment and trust in the plans are critical for success.
Thank you both for the good work that you are doing every day and for sharing your insights with us. To learn more about these efforts, check out the website for our framework at housingequityframework.org. Thank you.